Imagine waking up one day to find out that your health insurance, a safety net you've come to rely on, is suddenly at risk of disappearing. For 130,000 Alabamians, this nightmare could become a reality if Congress fails to act. But here's where it gets even more alarming. Not only could these individuals lose their coverage, but premiums for those who remain insured could skyrocket by an average of 93%. This isn't just a numbers game. It's about real people, families, and communities facing the prospect of unaffordable health care. And this is the part most people miss. The ripple effects could extend far beyond individual households, threatening jobs, hospitals, and the state's economy as a whole. Over the past 4 years, Alabama has seen a remarkable surge in health insurance coverage, with the number of insured residents nearly tripling. This dramatic increase is largely thanks to the Affordable Care Act, ACA, and the enhanced tax credits that made insurance more affordable for hundreds of thousands of people. But these very credits, which have been a lifeline for so many, are set to expire by the end of the year. Their fate is now tangled in the political gridlock that led to the federal government shutdown. Debbie Smith, campaign director for Cover Alabama, a Medicaid expansion advocacy group, puts it bluntly, "Since we haven't expanded Medicaid, we rely on these tax credits a lot. It's really been holding up our healthcare system as a whole. Without them, she fears the system, already fragile, could crumble. The stakes are staggering." According to KFF, a health policy research nonprofit, approximately 130,000 Alabamians could lose their coverage if the credits aren't renewed. Meanwhile, the Commonwealth Fund warns that Alabama could lose 9,100 jobs, primarily in healthcare, if the subsidies expire. That's the 7th highest job loss projection in the nation. To put it in perspective, nearly 10% of Alabama's population, 477,838 people, currently relies on subsidized health insurance through the ACA. If these credits vanish, the state's uninsured rate, which dropped from 12% in 2020 to 8.8% in 2022, could reverse course dramatically. But here's the controversial part. While Democrats argue that extending these credits is an urgent priority, Republicans contend that the issue can wait. House Speaker Mike Johnson has dismissed it as a December 31st issue, the deadline for the credits to expire. This partisan divide has left Alabamians and millions of Americans in limbo. Catherine Hempstead, a national health policy expert, points out that states like Alabama, which haven't expanded Medicaid, would feel the impact far more acutely than states like New Jersey or Massachusetts. It's led to a huge increase in enrollment in those states, she says. If they're not extended, Alabama is going to notice this a lot more. The enhanced tax credits, first introduced in the 2021 American Rescue Plan and extended through 2025 in the Inflation Reduction Act, removed income caps, allowing individuals earning up to $62,600 and families of 4 earning up to $128,600 to qualify. If these credits expire, not only will many lose eligibility, but others may opt out of insurance altogether due to soaring premiums. KFF estimates that premiums nationwide could more than double without these credits. The debate has sparked fierce political battles. Democrats in Congress have refused to pass a Republican-sponsored funding bill unless the credits are extended, arguing that millions of Americans depend on them for affordable health care. Meanwhile, Republicans argue that the program was flawed from the start and question why the wealthiest should benefit from these credits. Senator Katie Britt criticized the ACA, stating, "The program was deeply flawed from the beginning, and it makes no sense to continue to allow the most wealthy among us to access these credits." The consequences of inaction are dire. Hospitals, already operating on thin margins, could face a surge in uncompensated care as more people lose insurance. Danny Howard, deputy director of the Alabama Hospital Association, warns that emergency departments would become the only option for many uninsured Alabamians, placing immense financial strain on hospitals. A recent study by the Urban Institute and Robert Wood Johnson Foundation found that hospitals nationwide could lose $2.2 billion in uncompensated care costs in 2026 if the credits expire. So, what's next? The ACA Marketplace enrollment period opens on November 1st, but experts worry about the chaos that could ensue if the credits aren't renewed by then. Here's the question that lingers. Can lawmakers set aside partisan differences to protect the health and financial well-being of millions? Or will Alabama and the nation pay the price for their inaction? Let us know your thoughts in the comments. This is a debate that affects us all.